My dear friends, I'd just like to share a few words with you. I just thought I'd share a few thoughts with you about the medical profession. Much has changed in the medical profession, as you know, but the core remains. Ultimately, it is all about a medical professional being at the service of a suffering patient. That's really its core. And that's why people have always regarded this as a vocation rather than a profession. Because the idea of a vocation implies that you have been specially called by God to this task. You have been specially gifted for this task. You are a participant in God's work of creating life and of bringing healing. That's why it's a profession. That is why you will find in the booklet later on a little reference to a passage from the Bible where it says, honor the physician with honor due to him. For the Lord created him. Give the physician his place, for the Lord created him. But that vision today is being challenged. And I just indicate to you a couple of these challenges. The first one is what is generally called the commodification of health care. Health care has become a commodity in the marketplace. And that is why big businesses entered into it. And unfortunately, the result is people are in it for profit. The bottom line becomes the most important thing and not the patient. And the poor are left out. And that's why it's a struggle for the honest medical professional to remain true to his vocation, to see it as a service. A second challenge comes from the field of technology. We've got to be grateful to God for the rapid development in the sciences and in technology that have helped us much more efficiently and skillfully to take care of the sick, of the suffering, to ensure a better quality of life, a longer life, a more pain-free life. But sometimes these developments have come at a cost. And one of the costs is that care has become depersonalized. People are no longer willing to listen to patients. They subject them immediately to tests, to the cold hand of technology. And the challenge today is to be able to transform the stethoscope and the ultrasound and everything else into a human touch. Because of all the gifts that you have, the gift of touch cannot be replaced. You can use the latest diagnostic tools, and you should. But you cannot forget the human touch. And that is why the Fernandez hospitals will continue to struggle to buck the trend, to continue to be faithful to its mission statement that emphasizes service, that emphasizes ethical practices, that keeps as its core values honesty, compassion, and care. And just as a way of helping you to remember what you're about, just think of the root words of hospital and patient. The word hospital comes from the root word that speaks of a guest, of hospitality, of welcome. And a patient is one who suffers. And you welcome them so that you might serve them and help to bring God's healing touch to them. I thank you for your commitment to this vocation, and I pray that God will keep you faithful to this task. God bless you.